Well, welcome, Aspire Minnesota. We are just delighted to be in this conversation with you about your very incredible system, CORE. And so today is really about updating everyone on where we're at with CORE so that you are up to speed and equipped to implement along with all of us beginning in January of 2022. Today, Rachel Peterson, who is behind the magic behind all of this CORE work, will be walking us through an update. And we also have colleagues here from our CORE team, Heidi Seaton and Don Peterson, and our CASHU colleagues and the ETI colleagues who have been making this magic happen, but really you and our the legacy that was begun in the 1980s of leaders who were in your very same seats who decided that outcome measurement was really important for kids and families because of the way that we want to value services today and in the future. And the belief we have around quality, the belief we have around ever improving care. So there are so many wonderful values, histories, and futures that lead us to this conversation today. So I want to extend incredible gratitude on behalf of the whole association to the team that's made this possible and to you, because you're going to make the real magic happen once CORE becomes actionable and live in your hands and the hands of your colleagues. So with that, just simply wanted to extend a very warm welcome and enthusiastic kickoff to today's webinar.
Thanks so much, Kirsten. I'm Rachel Peterson. I work with Kirsten at Aspire Minnesota, and yeah, thrilled to see so many of you joining us today for this briefing on the Children's Outcome Reporting and Evaluation System. So if you can bear with me here, I'm going to share my screen. All right, can everybody see the first slide here?
Yes.
Great, thanks Allie for the feedback. It's always nice to get verbal feedback when you're doing a screen share. So just to point out, this is the Aspire Minnesota CORE logo that was designed by our colleagues at Educational Technology Innovations at the University of Minnesota. It's lovely. So you'll see this color palette throughout the presentation. So the purpose of this briefing today is to really update Aspire Minnesota member organizations on this new Children's Outcome Reporting and Evaluation, or CORE system, and then plans for implementation on January 1st of 2022. And also, of course, to answer your questions about implementing CORE within your organizations. As Kirsten mentioned, you are the key piece of this CORE puzzle. So the briefing has 6 parts. Part 1 will cover a brief history of CORE's predecessor that I know many of you are familiar with, the Student Data Reporting System, and also kind of how we got to where we are today. Part 2 explores the deep significance of CORE for the full association, including how it benefits individual member organizations, the broader association, and the Children and Family Services continuum. Part 3 describes kind of what type of system CORE is. That'll make a little bit more sense when we get there. Part 4 covers the specific data collected through CORE, the outcomes, and the reporting. Part 5 will go a bit more in depth into how organizations can kind of prepare for implementation and the start of using CORE on January 1st, 2022. And then the final part will open up for questions from any and all of you. I will pause for questions as we kind of go through this briefing so that you can ask kind of in the spur of the moment too. I'll do that a few times throughout. So part 1, an introduction to CORE. So a little history first. In 1985, for all of you doing that math really quickly, that's 36 years ago. Under its previous name, the Minnesota Council of Residential Treatment Centers, Aspire Minnesota has had a couple of name iterations. The Minnesota Council of Residential Treatment Centers received funding from the Bush Foundation to develop and implement the Student Data Reporting System, SDRS, And for over 35 years, 36 years, this system, through an access database, has provided member organizations with the ability to report on outcomes, data, demonstrate efficacy, and promote improvements in service delivery while driving important discussions with stakeholders, your legislators, your funders, and many other partners. So over the past years, Aspire Minnesota has been conducting a complete system upgrade, renaming the student data reporting system the Children's Outcome Reporting and Evaluation System. Unlike its predecessor, SDRS, CORE is designed for all children's service providers, residential treatment, outpatient and related community-based services, and foster care, relative care. Some parts of CORE are more clinically oriented, and the design allows for services that are not as clinical to continue to gain value from the data collected and outcomes reported, including foster care, services for youth experiencing homelessness or sexual exploitation, nurse home visiting, and the like. I think we're getting a little feedback here. If everyone could just double check and make sure that they're muted, that would be lovely. So the collaborative data effort of Aspire Minnesota, it's unique in Minnesota, as most public systems collect minimal data on the well-being of children and youth they serve, but also unique nationally. In fact, only a handful of entities across the US harness data like that of CORE. The CORE system will continue to inform programs and policies while improving and deepening impact for Minnesota's children and families. And Kirsten touched on this a little bit earlier, but there's a lot of people involved in bringing CORE to life. So I just want to call out some of those folks. The Aspire Minnesota CORE team includes Dawn Peterson from Northwood Children's Services, Heidi Seaton from North Homes Child and Family Services, and Dr. Anita Larson from Nexus Family Healing. And then advising on content, reporting, and research potentials are doctors Tracy Lalibert and Christy Peitscher from the Center for Advanced Studies of Child Welfare at the University of Minnesota. And of course, Educational Technology Innovations at the University of Minnesota is leading the technological development of the CORE system. Yeah, you definitely wouldn't have wanted any of us other folks doing that technological piece. So we're super grateful to have our colleagues at ETI leading that. But of course, it's all of you who are the most important pieces of the CORE puzzle, you, the leaders and staff at Aspire Minnesota's member organizations. We couldn't and wouldn't be doing this without all of you. So moving on, part two.
Rachel, I'll just pop in and say that there was a committee that began working with our colleagues at the Center for Advanced Studies in Child Welfare that formed in 2014 and did a tremendous amount of work there. And I see that some of those committee members are with us today. So there is quite a legacy of investment time at kind of at intellect that has been poured into this, and so many people that have been fundamental to that along the way.
Great. And Kirsten, that's a good reminder for me. I can't see any of you right now because I've got my big screen share going here. So if anyone on the CORE team is seeing people raising their hands or there's chats, just stop me. Thank you. All right, part two, the value of CORE. Why are we doing this? Evaluation services, as you evaluation of services, as you all know and are experts in, is increasingly prioritized as we review investments in treatment and interventions for children, youth, and families. So through CORE, Aspire Minnesota member organizations will provide practical leadership in support of assuring quality metrics, accessible reporting, and meaningful outcomes to inform how we build our continuum. Kirsten alluded to this as well, that hours of debate and exchange regarding which specific data should be collected through CORE happened in the past 5 or so years. And the data fields that are collected through CORE have been carefully curated by research and service leaders, many of you, to ensure that the data would have immediate value for our goal of increasing understanding of services and promoting increased quality of services. So CORE has been designed to capture data that otherwise is not being reported on. Data determined to be quote unquote nice, but not necessary will not be collected by CORE. So by design, CORE looks at a child and family accessing care in a way that goes beyond what existing siloed data collection does. The CORE platform can deliver a variety of timely reports on progress and outcomes to participating organizations, including real-time, kind of at your fingertips, customizable reports for organizations, the association partners like DHS, and other outside researchers and evaluators. I'm going to hand it over to Heidi Seaton from North Holmes to kind of dive in a little bit deeper on that point.
Hello. Like Rachel said in the beginning, CORE is collecting data that we typically wouldn't otherwise collect, that other systems don't collect, that a lot of the standardized assessments and screenings that we do does not collect. So that in and of itself is valuable. You can use it to guide treatment planning for youth. You can use it to look at patterns of both internalizing and externalizing behaviors that you're seeing in your current population, and use that data to adjust programming or service delivery to better meet the needs of your current population. One of the nice things, our intent is to have the satisfaction surveys sent out via text message, which I think will really increase response rate of that. I know we struggle with that a little bit. People get a lot of surveys, and I think having it through text message is just another way that we'll be able to get more response from that, both from parents and placing agents and the youth themselves.
Thank you, Heidi. So other reporting opportunities include annual outcome reports on all programs included in the data set, an annual aggregate outcome report on all CORE data, and data that can be queried and reported on based on specific program types and individualized to contribute to greater depths of analysis as needed. And I'm going to hand it back to Heidi here to speak a little bit more on that.
Agencies will have the ability to query and report data based on specific program types. They'll be able to individualize those reports to better communicate their an analysis of what their needs are and what the needs of their programs are. This system does have better inclusion of clinical data, so it is collecting assessment and screening scores. So you'll be able to look at those scores within your own organization across programs, within programs, and then kind of look at what the greater association is seeing with their populations as well, based on those scores. Follow-up data we'll be collecting, and that can provide a lot of insight into the strengths and weaknesses of the program, specifically tools and skills that the children are taking with them when they leave, to help prevent them from having to go back into residential if that's where they were at before. So you can gain some insight into that. It will provide the ability to make program comparisons, like I said, within your organization. And then you can use that data for a variety of things, whether it's strategic planning, your host county contract negotiations, when you're looking at needs and the needs of the current population and how those needs change, annual reporting requirements, with using them in your logic models that are required by COA. So there's a lot of benefits and opportunities to use the data, and it's real time, which is nice.
Great. Thanks so much, Heidi, for sharing those really concrete examples. So CORE also offers a valuable foundation for conducting research studies on long-term factors and outcome scenarios for children, youth, and families with data held by other state data sets. And on this point, I'm going to hand it over to either Tracy or Christy or both of you from CASHU to speak a little bit more.
Sure. I'm Christy Peischer from CASHU, Center for Advanced Studies and Child Welfare. And I think one of the really unique features that we've built into CORE is, the fact that CORE now has the capacity to provide that real-time customizable reporting feature to all of the agencies, which is something that Aspire Minnesota used to have to contract out. And then of course there was the time lag. So the funds that were previously devoted to those annual reporting can now be repurposed for conducting research studies on some of the long-term factors and outcome scenarios that Rachel was referencing. So for example, thinking about the data that's in core being individually identifiable child level data will allow us to really harness the power of some of the other data systems like MNLink. And for people who aren't familiar with MNLink, MNLink is an integrated data project that's housed at the Center for Advanced Studies in Child Welfare in the University of Minnesota. And so what we do at MNLink is connect records of children, in this case, children served by Aspire Minnesota member agencies, based on the records held within core, to a variety of other kinds of statewide data systems. So thinking about connecting kids' records to education data, to human services and child welfare data, juvenile court data, of course, with permission of the courts, allows us to be able to kind of think about data in a really broad perspective. So the data at MNLink, for example, spans over 20 years, and it will allow us to look at historical patterns. So what are the predictors of kids coming into some of our service systems, and how do they proceed then after, how do they fare after they leave those service systems? And that's something that we hadn't been able to do prior to core. So the number and types of questions that we can ask based on the data that's held within core are just really enormous. And so while it's not a reporting feature of core, it's an opportunity for really new and exciting endeavors that we can pursue simply because of core. And I think as we start implementing core itself, we'll be able to talk a lot more about what that might look like and how we might do some of that work moving forward.
Thanks so much, Christy. I am going to pause for questions. And again, I can't see anybody, so if my colleagues could help me out here. Any questions at this juncture?
Hi, this is Regina Brown. I have a question regarding how the queries work. So would we go through the core team to get a custom query, or is there access to the data set that you build your own custom query? How does that part work?
Thanks, Regina. That's a great question. And core is really designed to be incredibly user-friendly and really having you, the users, at the center. So the point is that you can pull your own queries through core. So I don't know if my colleagues want to elaborate at all on that.
Thank you.
Yeah, I think it is an excellent question, because one of the things that I alluded to is prior to core, right, we would have to wait for all of the data to come in, the outside evaluator. In the past short bit of time, Cashew's done that work. We'd have to wait for all of the agency data to come in, then we could clean it, and then we could turn it back around to agencies. And so the delays were like a year. And in fact, with core, it's essentially you log into core and you're going to point and click, and then you can query those same reports that we generated plus a whole bunch more. So like if you want to cut it by a different time frame than the calendar year, you could do that sort of thing. So it's all agency driven and extractable, and you don't have to wait for anybody else except for your team.
Perfect. Thank you.
Yeah. Great question. Thank you for that one. Are there any other questions? Well, also, I will say we'll get into that, the reporting piece in a little bit more detail a little bit later on, Regina, too. So, but any other questions? All right, hearing none, we'll move on to part 3. What is core? So core is designed to help build consistency in data collection across the entirety of the Aspire Minnesota Association. Core is a user-friendly, as mentioned, HIPAA-compliant, web-based system designed for Aspire Minnesota member organizations to collect relevant data on children and their families in order to support your ongoing learning, targeted growth in service delivery, system investments, and shared accountability to deliver quality services for for our children, youth, and families in the state. CORE is available to all Aspire Minnesota member organizations and can be accessed through a computer or phone. And as Heidi mentioned, our plan is to have the satisfaction surveys actually be distributed through text message, which is really kind of new and a new and innovative approach of collecting that particular data. So based on feedback from member organizations, CORE also includes a function to export some limited demographic data from certain EHRs into CORE. This is done in an end-to-end encrypted manner, meaning that the application is incredibly secure. So we'll be covering that and many other things in a series of training modules we'll be creating that will be coming out in the month of November. So stay tuned for those. That'll go more in depth in some of these more specific aspects of CORE. The next slide you're going to see outlines the taxonomy that we're using within CORE. So there are 40+ members of Aspire Minnesota, and the language and the words that you use to describe your own organizations, it varies across the association. So pretty early on in the process, we needed to identify some shared terminology. So what you're going to see here is the naming structure or taxonomy that we've decided to use within CORE. So at the top, you'll see the organization. This one is the highest level, and examples are all of your organizations. Nexus Family Healing, Northwood Children's Services, Port, Family Alternatives, Lutheran Social Service, Little Sand, Group Homes, etc. All of you, you're all organizations. And the next one down is kind of a little bit of an exception because there are very few organizations that have agencies. And in fact, when we were thinking about this, it may just be Nexus Family Healing that has agencies underneath, like Nexus Girard, Nexus Mille Lacs, Nexus Kindred, etc. So unlikely that most of you will use the agency category when you're getting CORE set up in your home organizations. Underneath agency is site, and this refers to a physical place. And every organization will have at least one site. Some will have many sites. And then of course, different programs associated with those sites. And then as mentioned already, there are 3 core program types: residential treatment, and then community-based services, and foster and relative care. And CORE will be a valuable tool for all of those 3 program types. And then I've just listed a few of the sub-programs. There are many, of course, but some examples being CTSS, Psychiatric Residential Treatment Facility under residential, and Therapeutic Foster Care under foster care. So that gives you a little feel for some of the kind of language that has been chosen to be used within the CORE system, so you're familiar with that. So moving on to part 4, the data, outcomes, and reporting, the exciting part. So CORE collects a lot of different data, as Christy and Heidi have spoken to. Basic demographic information about the children and youth receiving services at Aspire Minnesota organizations, including data on age, grade level, race, gender identity, and characteristics of the child or youth's primary household. And then through intake, discharge, follow-up forms, and satisfaction surveys, CORE allows for reporting on several important outcomes for children and youth, including basic physical health information, information regarding abuse and neglect, placement and housing related data, including questions about experiences of homelessness, re-entry into services, service or treatment prior to placement, delinquency history, school-related services, and internalizing and externalizing behaviors. CORE also incorporates data from a number of assessments, including the Strengths and Difficulties Questionnaire, the Child and Adolescent Needs and Strengths Assessment, early childhood service intensity instrument, EXI, CASI, youth level of service inventory, the POSIT, problem-oriented screening instrument for teenagers, and then of course the satisfaction survey data. And then new to CORE that wasn't included in the previous SDRS system is the University of Minnesota's Traumatic Stress Screen for Children and Adolescents, the TSSCA. So this is an efficient yet very precise 5-item tool for screening and identifying children ages 5 to 18 who may have experienced a traumatic event and be in need of services. So I'm going to pause again for questions because that was a lot of information.
This is Regina again. I'm just curious as to how the data is captured.
Yeah, that's another great question, and I'm going to get into that next.
Rachel, this is Jamie from BOA.
Yeah.
I had just put in the chat. I was just wanting to go back to understanding the part about how the organization followed by the agency and just get some clarification on exactly what that means and how to organize our information in there. And I'm just wondering if somebody like, I mean, I understand Nexus, but I'm wondering if somebody like us might also have an agency distinction or not. I don't know.
Yeah, Jamie, thanks. That's a great question. VOA is the other one that we actually were sort of, we should discuss that. And I think it will kind of be up to VOA to determine. There are some differences between VOA and Nexus in the way that that things happen and are run. But that's something that you and I should follow up on and have a conversation about.
Okay, and I think Andrea's on the call today too, and
yeah.
maybe we can just follow up together among.
Yeah, I can be included in that as well. Thanks.
Okay,
Yeah.
Thanks, Andrea.
Absolutely. Ultimately, I think it'll be up to organizations to make that determination themselves. And of course, we're happy to offer any guidance as you're sort of thinking about that. Yes, thank you very much. Any other questions?
Rachel, it's Joanna from Valley Lake. So will we be able to see, typically at the end of the year, we can see ourselves compared to other facilities. Will we be able to see that in real time throughout the year on our dashboard, comparing ourselves to other facilities?
Yeah, great. Another great question. And I'll also, Christy and Tracy, you can also feel free to jump in too, but if I misspeak, but that is something that we'll get into the different sort of data roles within the organizations and then at Aspire Minnesota, but that is something that Aspire Minnesota will do across the association. So individual organizations won't have that particular access. You'll really only be able to access at any given time your own data, but we will be pulling those types of reports. And again, if Tracy or Christy or Kirsten or Heidi want to jump in, Dawn, to elaborate on that at all?
Yeah, I think, part of the beauty of CORE is that right now we're building we're in the middle towards the end of building a really base platform. And so having the continuation of ETI along with your core Aspire Minnesota representatives allows us to kind of continue to build that platform out. And so how Rachel talked about the divisions between organization and agency and things like that, depending on how your particular entity is set up, will allow you to see more or less data, I think, in your reporting pieces, because the way that those structures are set up allow for permission of what you can do, but then also what you can see. So I think the reporting features are some of the last things that are being built out, but I know how incredibly important it is to be able to see your organization along with similarly situated organizations. And so I think there'll be some of that kind of information, and it just will depend on how it comes out.
Just to add a little bit, because this is a very important topic, we had some discussion around the just-in-time data versus the annualized data, and you will be able to access just-in-time data, as was referenced earlier, based on what you've inputted, at what intervals you want to do a look across whatever catchment of data that you currently have. And the association will need to be in some conversation. At this point, we're thinking about pulling annual reports where we would be able to do those aggregate level comparisons and draw out specific reference points for each organization. But this is part of the adventure of CORE, is that we will be able to decide together as an association what you, based on your needs, when we pull those reports, and how we do that in this kind of wider association community. So thanks for prompting that conversation, Joanna. It is of critical importance today and will continue to be as we move ahead.
Yes, thank you for these great questions, everybody. To Regina's second question, the next series of slides is going to give you sort of a little feel for what the CORE system looks like and how things are laid out. It's, as mentioned, it's web-based, so you're going to access it through a website, through a URL. We think we know the URL, but I won't share it today because it's a work in progress, and we haven't totally nailed down what the actual URL will be for sure. But it'll be super easy to access on the internet and with a login for the staff that you deem appropriate for data entry, the different data entry roles. So here is an example. It's a screenshot of this wonderful system that's being created by ETI. So kudos to them for creating this very user-friendly interface. This is a screenshot of the dashboard, as you can see, for Hogwarts organization within CORE. And you get an overview here of staff users and then the clients. At Hogwarts, there are 7 clients. And then when you click on Manage Organization, which is up kind of next to the Hogwarts name, then you're going to go into this screen where you can update information about your specific organization. You can add staff, you can add clients, et cetera, et cetera. Going back to the dashboard here, if you select View Profiles on the left here in blue, then you're going to go in here and get an overview of all of your clients, right? You can see sort of the status of them. You can look at in progress forms like the intake and the discharge and assessments. And then moving on, I've got a few screenshots here from the intake form, just so you can see, kind of get a feel for what that looks like. This one is child demographics. And then here's the assessments, just a screenshot from that particular page. And then here's the one for internalizing behaviors. It goes down. I could only get, part of it on one screenshot, but you get the feel for, yes, I hear a question.
On the assessments page, if you want to just go back one, Rachel, sure. These are the assessments that are currently used by some, not all, of service providers and individual programs within each of your organizations. And so Rachel did a very meticulous job of engaging with each organization, asking which assessment is used, because we want the assessment to be of value here in CORE as well. And we do also know that not all of you on this call or in our wider association do, quote, clinical work. Or do, and so that also is honored here. So I want to make sure that everyone knows that while we are seeking to capture all of the clinical data that you are using on a daily basis, we also do not require that, nor is that part of the, kind of the concept here. And part of what we're aiming towards in all of this work is to make sure that this is as inclusive as possible of the children and families that you're serving. And that is quite a big goal, because you all do quite diverse activities with kids and families. So I just wanted to make note of that, Rachel.
Yeah, thanks so much, Kirsten. That's a really important point, and glad for you to share that, to give it extra emphasis. Moving on here's this screen again, and then here are some screenshots from the discharge form as well for Delilah Dundee particularly. So child demographics for the discharge form. You can save progress or you can submit, and of course you want to submit it once it's completed. And here are the services and treatments. And I believe that's the last of the screenshots. So just, yeah, I wanted to give you all a feel for what the online system looks like. So we'll move on to part 5, which is how do we use core?
Can I ask a question, Rachel?
Oh,
You
yeah.
mentioned earlier, this is Katie from VOA, that there is some capability to communicate with EHRs. Are you able to provide that list of what EHR systems can work with the core system?
Yeah, so that has been a really a big sort of a big push, and I think I'll hand it over to John or Jake to speak a little bit to that piece. As mentioned, there's an opportunity to transfer some limited demographic data from a number of the EHRs, and it's important to also know that 40 plus member organizations are using maybe 15 different EHRs, could be more in fact. And that's, and as we've grown our membership in recent months, kind of keeping up with all of those different EHRs is important, but also challenging. So Jake or John from ETI, do you want us to speak briefly about that piece?
Sure, I can do that. This is Jake. I'm the lead programmer at ETI. I've been doing a lot of the work writing this integration and importing functionality for the EHRs. I think our approach right now is just to start on a bit of a case-by-case basis, right? So we're planning to support 3 different methods for getting your data into core. One is, like you mentioned, automatic integration with the various ways that EHRs export data. So our hope is that some EHRs and providers will have the level of technological capability in their organization to automatically export things from their EHR on a scheduled basis, and then send them to the core app, and the core app will process them and import them into the app. So with that sort of system, it would all be automatic on a scheduled recurring basis. With that, I think we're going to handle it case by case, like I said, just because there are a lot of different EHRs and every provider sort of implements EHRs a bit differently. So rather than, I think in order to support the most that we can, the highest number of them that we can, we're going to sort of have people start integrating, sending their data to core. We'll see what we get, and we'll write importing functionality to the data that we receive, and over time try to standardize or normalize that based on the data that we get. I mean, in short, we just don't know really what we're going to get, because there's a lot of different EHRs and a lot of them are implemented differently. So we have to see what we get and then kind of write our importing to that to accommodate that. That's kind of where that's at. The second approach to getting your data into core is just to upload it manually. So you can export from your EHR and then go to the core app, and in the user interface, there'll be a place to upload it manually, and then the core app will import the file that you upload. So for that, we'll probably have some sort of specification, right? Like download an example CSV file or Excel file or whatever, and then put your data into this format and then upload it, and we'll process data in this, predetermined format. And then the third way is just, of course, to manually add your data to core through the user interface and the forms that are provided in the user interface. So I think our plan is to become, all that's really just to say that our plan is over time, I think, to become more sophisticated in our integration and importing capabilities. But at first, we're going to have to sort of start by seeing what we get. And, sort of starting from there, I suppose. Does that make sense or answer your question?
Jake, I think one question she has is they are updating their systems to use Credible. Is Credible amongst those that you've already engaged with?
Yeah, I think Yes, that makes sense. I think I can't remember. I think we've talked to Credible, and I think there are other organizations in the network using Credible also. And if I remember, there was a survey taken of the member organizations and which EHRs they used, and Credible was commonly used. So I think we'll aim to support Credible. But ultimately, I think the goal is probably to support whatever the member organizations use, right? Like to make it so that these member organizations can get their data into core easily, whatever system they happen to be using.
And what we can do is we can provide a list of those that we have created those integrations and what they look like to the member groups.
Yeah, that would be great. I will say that the ETI team has met with a number of EHRs over the past months, including Credible. So there has been at least one meeting with Credible. And yes, that would be great, John, if you could supply that list and we can share it with everybody.
Yeah, as I'm sure folks are aware, that the EHRs and data integration with them can be quite challenging. And each one, like Jake was saying, each one is kind of implemented uniquely in a lot of ways. And so that can create some challenges from that integration. But as we continue to kind of forge ahead with those pieces and making those integrations, we'll make sure that everybody is aware of them as we kind of move forward with it. And the beauty of the system is that you have a multitude of different ways to actually get the data in, not just from an EHR, so we have cases where folks don't actually have an EHR and they're using something that's a little less sophisticated to actually handle and manage their data. They'll be able to actually put data into the core system either manually or through some type of import of an Excel with that data in it.
Great, thank you, John and Jake. So moving on to part 5, we want to make sure that we have some time at the end here for some more questions from you all. So how do we use CORE? As mentioned, it's a web-based system. It's accessed through a website on your computer or phone. And then, so there are 3 types of sort of primary CORE users. 2 are within the member organizations, and 1 is external at Aspire Minnesota or Cashew. The 2 within your organizations are data entry and data manager. And not all organizations will utilize both those roles. Some will just use one. Some might just have one person that does that actually at some of our smaller members. So we'll get much more in depth into that stuff in the training modules that I just mentioned earlier. So we're not going to go into super detail in the different roles right now. But yes, that will be a topic of in a training module. As we've just discussed, most data will be entered manually into CORE, especially in the beginning, but there is that feature to bring data over from EHRs that John and Jake spoke about. So utilizing reports, the reporting piece. So the R in CORE, of course, stands for reporting, which is a really essential feature of the system. And because the data collected through CORE isn't collected elsewhere, CORE affords organizations the opportunity to report their own outcomes data, as we've discussed. So real-time reports can also be used to support your marketing and communication efforts, fundraising and grant writing, and building partnerships with other service providers in your communities, like schools or other partnering nonprofits. And then just finally, the last point before we open up for questions, as Tracy and Christy touched on earlier, the CORE system has been built to run agency-specific reports. And it also has the capacity to link to other administrative data systems that include service type, service time frame, school-related data, which can be used for sort of longer-term research purposes. Just what remains to be determined is how that type of data will be made available to agencies in an aggregate form outside of CORE. So that's a big topic of discussion as well, and really exciting when we think about the future of core kind of moving forward. So part 6, the Q&A. I'm going to take myself off of screen share here and open it up for any additional questions. Also would welcome comments from the core team if you feel like we should touch on something.
I think the first thing that should be said at the conclusion of the slides is a word of gratitude to you, Rachel, and to the whole team. Thank you so much for making this happen. There are many more stories to be told, and we are not totally there yet as it relates to completely finalizing this very exciting new product of yours, association members. But much gratitude needs to be extended to all of you. And I was asked in the chat earlier how we were able to fund this, and I did want to extend a word of gratitude to the Sauer Family Foundation and to our colleagues at Cashew and our colleagues at ETI, because they really have been able to leverage those funds judiciously and allow for this really incredible product to come forth. So many thanks to be extended to so many folks, including everybody here on this call. And questions, what are people's questions?
I have a question. This is Chris from Catholic Charities.
Hi, Chris.
Can you hear me?
Yes, sure
Hi.
can. Hello.
So I'm wondering if like we've created pretty detailed client and caregiver satisfaction surveys. Are you asking that we are replacing or asking agents to do in addition to surveys to collect feedback? Yeah, I guess that's one of my questions first.
That's an excellent question. I'm going to open it up for Tracy or Christy or Kirsten or Heidi. We've had some discussions about this. The goal, of course, is to collect the same data from across our agencies, right? But we do understand that you're doing some of this too. So I'll open it up to some of my colleagues here.
I'll jump in. So it's a great question, Chris. And what we did initially to be able to go forward was to pull some of the satisfaction surveys that people had been using to create, kind of a composite. What are the similarities? What are the things that people are collecting? So as Rachel said, you're going to be able to see yourself in comparison to others. You'll be able to pull in the data that you want. One thing that that isn't currently set up but can be set up is whether or not you would then be able to add additional questions. So you should be able to look at the satisfaction survey in core, look at yours and say, well, there are these 3 questions that we really, really want, but they're not in here. And could you tailor it in such a way that when it's sent out to your folks, you would be able to get that? So we have the possibility of doing those things at this point, because there's been such a distance in time between when we first pulled the satisfaction surveys from everybody and now. People like yourself, like you just said, you just did a big revision and changed it. Things are somewhat different. So we're starting with the common pieces that we know that we had worked on. And then I think that we have to then adjust to some of these other pieces and look at how it is that things can be tailored. Does that make sense?
Yeah, I hear you. Thank you. Another question is, I was wondering if you had an example of reports that would be run for the organization. So if all this information is gathered, it's aggregated and reports will be coming back to us. Do you have like a sample of what those reports would look like or the information that would be collected?
That's also a great question, and something that we discussed as recently as a couple of weeks ago, to create sort of mock reports. We don't have one right now, but that is on our to-do list so that member organizations can see what that would look like. So you're thinking along the same lines as we are, Chris, on that point. And the reporting piece is, as mentioned earlier, sort of the last piece to kind of fall into place in the development of the system. So, but a super incredibly important piece of it, perhaps the most important piece. So.
And Rachel, if I can just add, you know, those reports are going to show up, like if you're looking for kind of visual examples, when you're in the core system, some of those screenshots that Rachel was showing earlier, basically you're going to see very nice visuals that represent the different data elements that we're collecting. So you're going to see pie charts and you're going to see, you know, descriptions and things like that. And you'll be able to download a report in like a PDF form after generating it through the website. So it should be real time, kind of point and click, grab, you know, the parameters that you want to include, and then be able to look at that data. And if it fits for you, great, you can download it and use it, whether it's for, you know, applications for additional funding or reporting for other kinds of requirements back to the state or other funders. We hope that it really meets some of your needs across kinds of different areas that agencies are tasked with reporting in.
And Christy, while I have you, I just, since I think of Cashew as our sort of data in, data out experts, Lucas asked a question, can you confirm that each member organization will be able to export their data out of CORE? In addition, any updates from DHS about allowing us to export from CORE and into their MHIS system?
Is Cashew then accounted for?
I think part of, I wish I had a complete answer. And part of it is that as CORE is being built, we are trying to figure out what the exact capacities are, but the intention is that CORE can not only, you know, that we upload some data to CORE from the EHRs, for example, if you choose to go that way, but then also to be able to export that data so that you can then share it with somebody else from your agency. So, you know, there isn't a button on the back end, for example, that you can say, send this to DHS, but you should be able to download your own agency's data and then upload it how it fits to other places.
ATI, did you want to add anything else to Christy's answer about the download capacity?
Yeah, one of the things that I wanted to also add to this is more not in terms of the downloading or the exporting of the data. It's really that when you look at software is not really just kind of one and done. The beauty of being able to develop a system like this is the fact that we can look at utilization, we can look at how you're utilizing it, we can also augment and add new features and functionality as it goes along. So it's always kind of constantly evolving to be able to fit the needs that come up. But you do have to kind of start at, you know, you have to have a starting point of all the critical functionality from the reporting, from the exporting, and from the importing standpoint. So as you kind of embark on this new piece with this really cool tool, that's one of the things to keep in mind, is that we have that ability to be able to start to solicit that feedback and look at what's in there, and also to then start building some additional functionality to the core system.
And John, thank you. That was very helpful, John. And while you're talking, there's another question about exporting data, which is, will it be exportable in format other than PDF?
When we kind of look at that, we would look at that as being exported out in what we call a .csv file. So then think of it like an Excel spreadsheet. Then you'll be able to modify that as you see fit and be able to put it into other different systems as well.
Thanks so much, John. The other two questions that we have before us is DHS engaging with CORE and translating the satisfaction survey into non-English languages. So on the DHS front, we have provided regular updates to DHS in various divisions along this journey. And I think that they are both interested and as is their nature, a little bit cautious about suggesting that there is anything firm and formal about our ability to collaborate. So that continues to be our abiding goal. We also know that DHS's systems are very elderly and not well maintained because they require public investment, and it's one of the last things that legislators want to throw money at is infrastructure and IT. So it's a goal. It's a conversation. And I really do think that once we get some of the deliverables that we're talking about here, as far as reports available in real time and not simply in concept and plan, I think we'll be able to continue that conversation a little bit more expediently. And on the question of translation to non-English languages, we have not gotten there yet, Lucas, and would certainly invite members within the association to assist us in making sure that we can translate into a multiplicity of applicable languages. So thank you for that.
Yeah, I would encourage you to reach out to me if there are languages that your organizations do a lot of work, have clients that speak those languages. Let me know what those are. And yeah, I think that's a really great point. Let's see, Catholic Charities has a department focused on outcomes and reporting that is quite intentional. I'm wondering, is this a requirement of Aspire Minnesota membership or encouraged for organizations that do not have internal systems to measure and analyze?
You know, Chris, I think that this is, you know, we can't make anybody do anything. And this system really is strong, similar to the whole spirit of the association. We all do better when we all do better, and we all do better when we all engage and participate. And so the goal of CORE has been to be developed in conjunction with the values of this association. So it is a value, and so that everyone can participate. So it is our deep and enduring hope that we will be able to make this system as such that it will be compelling and powerful for you, and as such also be powerful and compelling for the whole of the association and our shared work.
And Kirsten reminds me frequently that there are going to be bumps on the road as we are launching CORE in well, she's saying don't say that, but it's the reality of a complex system like this that that brings so much value to the association, as Kirsten just mentioned. I like to think of sort of where Aspire Minnesota will be in 3 years or 5 years when we've been using this system for that long and then beyond. But yeah, there will be a learning curve as we launch in 2022. And so of course we also ask for your patience and understanding as we endeavor together into the world of the children's outcome reporting and evaluation system. So there's still about a minute left. Are there any other unanswered questions? Again, hearing none. I want to just thank everybody for being present today, asking great questions, and learning about the implementation of CORE in your organizations. We're really excited to all do this together. And consider me sort of your primary contact person for CORE moving forward if you have questions. And if I can't answer them, we've got a great team of folks that somebody will be able to. So thanks again to I think it's John, Jake, and Allie, and I don't know if Viet is on from ETI, and Tracy and Christy from Cashew, and Heidi and Dawn, and Anita wasn't able to be with us today, Anita Larson, and Whitney, I think, is here from the Aspire Minnesota CORE team. So thanks to all of you as well, and especially thanks to everyone joining us. Have a great rest of the day.
Thanks, everybody.
Thank you.
Have a great day.
Bye-bye.
Bye.
Goodbye.